Necrosis overview. Exogenous cell injury resulting in uncontrolled cell degradation, normal cell enzymes responsible for controlled cell death, apoptosis, are inactivated. So, exogenous cell injury resulting in uncontrolled cell degradation. Key principles: there is release of intracellular components and presence of inflammation. Several types. There are several types of necrosis. There is coagulative necrosis, liquefactive necrosis, caseous necrosis, fat necrosis, fibrinoid necrosis, and gangrenous necrosis. So, coagulative, in coagulative necrosis, solid organs which allow preservation of cell shape by coagulation of cell proteins like heart, liver, and kidneys. Coagulative necrosis is a type of accidental cell death typically caused by ischemia or infarction. In coagulative necrosis, the architecture of dead tissue is preserved for at least a couple of days. Okay, so yeah, coagulative necrosis, solid organs which allow preservation of cell shape by coagulation of cell proteins, heart, liver, kidney, for at least a few hours. Coagulative necrosis is a type of accidental cell death typically caused by ischemia or infarction. In coagulative necrosis, the architecture of the dead tissue is preserved for at least a couple of days. It is believed that the injury denatures structural proteins as well as lysosomal enzymes, thus blocking the proteolysis of the damaged cells. So, remember, it is believed that the injury denatures structural proteins as well as lysosomal enzymes, thus blocking the proteolysis of damaged cells. The lack of lysosomal enzymes allows it to maintain a coagulated morphology for some time. Like most types of necrosis, if enough viable cells are present around the affected area, regeneration will usually occur. Coagulative necrosis can also be induced by high local temperature. It is a desired effect of treatment such as high intensity focused ultrasound applied to cancerous cells. So you can achieve a destruction or a necrosis of cancer cells by high intensity focused ultrasound Coagulative necrosis is most commonly caused by conditions that do not involve severe trauma, toxins, or an acute or chronic immune response. Again, coagulative necrosis is most commonly caused by conditions that do not involve severe trauma, toxins, or acute or chronic immune response. A lack of oxygen causes cell death in a localized area which is perfused by blood vessels failing to deliver primarily oxygen, but also another important nutrients. It is important to note that while ischemia in most tissues of the body will cause coagulative necrosis, In the central nervous system, ischemia causes liquefactive necrosis, as there is very little structural framework in neural tissue. Macroscopically, the macroscopic appearance of an area of coagulated necrosis is a pale segment of tissue contrasting against surrounding well vascularized tissue and its dry, uncut surface. The tissue may later turn red due to inflammatory response. The surviving cells can aid in regeneration of the affected tissue unless they are stable or permanent. The microscopic anatomy shows a lighter staining tissue containing no nuclei with very little structural damage, giving the appearance often quoted as ghost cells. The decreased staining is due to digested nuclei, which no longer show up as a dark blue when stained with hematoxylin. Anyway, so that was liquefactive necrosis. Okay, liquefactive necrosis again is caused by ischemia or infarction. Regularly, ischemia or infarction that causes coagulative necrosis will decrease the function of lysozymes, so they cannot chew up or destroy the cells. Coagulative necrosis is a type of accidental death, typically caused by ischemia or infarction. In coagulative necrosis, the architecture of dead tissue is preserved for at least a couple of days. That was coagulative necrosis. Now, what is liquefactive necrosis? In liquefactive necrosis, soft organs which allow lysis of cells and surrounding proteins, like the brain. So let's see liquefactive necrosis. Liquefactive necrosis is a type of necrosis which results in transformation of the tissue into a liquid viscous mass. Often it is associated with focal bacteria or fungal infections and can also manifest as one of the symptoms of an internal chemical burn. Liquefactive necrosis. In liquefactive necrosis, the affected cell is completely digested by hydrolytic enzymes. This results in a soft, circumscribed lesion consistent of pus. The fluid remains of necrotic tissue. Dead leukocytes will remain as a creamy yellow pus after the removal of cell debris by white blood cells. A fluid-filled space is left. It is generally associated with abscess formation and is commonly found in the central nervous system. In the brain, for unclear reasons, hypoxic death of cells within the central nervous system can result in liquefactive necrosis. This is a process in which lysosomes turn tissues into pus as a result of lysosomal release of digestive enzymes. Loss of tissue architecture means that the tissue can be liquefied. The process is not associated with bacterial action or infection. Ultimately, in a living patient, most necrotic cells and their contents disappear. The affected area is soft, with liquefied center containing necrotic debris. Later, a cyst wall is formed. Microscopically, the cyst space contains necrotic cell debris, and macrophages filled with phagocytosed material. That is liquefactive necrosis. Soft organs which allow lysis of cells and surrounding proteins, like the brain. Now, what is caseous necrosis? Caseous necrosis is a form of cell death in which the tissue maintains a cheese-like appearance. The dead tissue appears as a soft and white proteinaceous dead cell mass. Frequently caseous necrosis is encountered in the foci of tuberculosis infections. It can also be caused by syphilis and certain fungi. A similar appearance can be associated with histoplasmosis, cryptococcosis, and coccidioidomycosis. I used to say coccidioidomycosis, but it's coccidioidomycosis. In caseous necrosis, no histological architecture is preserved. On microscopic examination with hematoxin staining, it is characterized by acellular pink areas of necrosis surrounded by granulomatous inflammatory process. When the hilar lymph node, for instance, is infected with tuberculosis and leads to caseous necrosis, its gross appearance can be cheesy, tan to white, which is why this type of necrosis is often depicted as a combination of both coagulative and liquefactive necrosis. However, in the lung, extensive caseous necrosis with confluent cheesy tan granulomas is typical. The tissue destruction is so extensive that there are areas of cavitation, also known as cystic spaces. Anyway, I would like to know a little more about caseous necrosis, just because we need to know how it's formed, how it happens. And what I'm finding here in study.com is that caseous necrosis is a condition of cellular death that usually occurs in the lungs. When the lung cells die, they begin to take on a crumbly, dull white appearance that resembles cheese. Although caseous necrosis most often occurs in the lungs, it can also appear in other locations of the body, such as kidneys. The disease mainly causes is seen in tuberculosis, by Mycobacterium tuberculosis, and is spread through the air. Anyway, as long as I learned that, because I didn't find what happens exactly cellularly, but that's what we need to know. So caseous necrosis. Okay, so necrosis. In Now we're gonna see fat necrosis. Fat necrosis is a pseudo mass which may develop within the breast, often presenting as a lump which a woman discovers herself. Sometimes fat necrosis only shows up on a screening mammogram. Fat necrosis almost always occurs as an after effect of surgery of breast. So next one is fibrinoid necrosis. Fibrinoid necrosis. Fibrinoid necrosis also occurs in the walls of arterioles in malignant hypotension. Fibrinoid necrosis is a special form of necrosis usually seen in immune reactions involving blood vessels, known as type 2 hypersensitivity reactions. So this is very interesting. Again, is a form of necrosis or tissue death in which there is accumulation of amorphous basic proteinaceous material in the tissue matrix with a staining pattern reminiscent of fibrin. It is associated with conditions such as immune vasculitis, malignant hypertension, preeclampsia, or hyperacute transplant rejection. In small vasculitis, fibrin plugs frequently occur in the vessel lumen. But the term fibrinoid is usually used to refer to material outside the lumen of the vessel. Fibrinoid necrosis also occurs in the walls of arterioles in malignant hypertension. Again, fibrinoid necrosis also occurs in the walls of arterioles in malignant hypertension, which is blood pressure greater than 200/130. Fibrinoid necrosis is a special form of necrosis usually seen in immune reactions involving blood vessels, known as type 3 hypersensitivity. This pattern of necrosis typically occurs when complexes of antigens and antibodies are deposited in the walls of arteries. Okay. What kind of trauma causes necrosis? Inflammatory. Next question. What kind of trauma causes ankylosis? What kind of trauma causes